Okay, do you have stress or do you have trauma? Can you have both? You can have both. All right. So, we're going to be talking about the next steps on your journey to thriving. And I'm going to go ahead and share my screen. Let's pull up a share real quick of the stress continuum because I'm a visual person and you may be a visual person. And I want you to know what it is I'm talking about while I'm doing this. So, I'm going to share this screen. It says it's sharing. We want to be where the blue zone is with the heart emoji eyes. That is thriving. All right. Here, the question is, though, are we spending time in that thriving or are we spending time in that trauma? Both are in the blue zone. Both are parasympathetic. They're just two sides of the coin. All right. And often they're really hard to tell which side we're on. And it doesn't matter if we are in thriving or if we're in trauma. There are going to be life stressors and we are going to get stressed. I was there today. I woke up this morning and I was like, where am I? And guess what? My default is the green zone, and that is where I was at. Now, I was moving through it. All right. And I was able, with some of my tools, to get myself, I was probably still at resistance. I'm just going to be honest with y'all, but I was working towards thriving. Okay. We can be in that trauma state and we can still be in this yellow, green, or red zone. So that is what we're going to talk about a little bit tonight. Now, I've noticed there's a couple people on here that was actually at the Oklahoma Occupational Therapy Conference that I was at last Friday and Saturday, so almost a week ago. And I had the wonderful opportunity to present, right? Living a life of less stress and more energy. And as much as I love to present about this topic, what I loved even more, all right, is how many people took the stress quiz and was able to take the first step of awareness on where their current stress level is. Okay. So the difference between me today and me 15 years ago, I would have woke up and said that I wasn't stressed. This morning, I was like, let me define that a little better. And I was able to get to the fact that, you know what? I'm in the green zone. Okay. I was in the go. Let's check things off the list. Let's get things done. Right. And that is where I was at. But now I'm aware. And that is always our first step. So I was so happy that I was able to share this stress continuum with others. Okay. Here's the thing. There was a lot of college students that were coming up saying they were in the red zone. I want you to look at that red zone because it says crisis. It says overwhelm. It says anger. And though I really hate to hear this is where they were, I was so happy that they were beginning to see and understand how important it was for them to take care of themselves and move out of that red zone. Okay. So just like this morning, me being aware that I was in the green zone, knowing if I continue going clockwise, I'm going to be in that red zone and maybe even leading myself to trauma. Okay. And that's not the direction I want to go. So I needed to make sure I was aware. Number one, I'm in the green zone. Number two, I'm going to move counterclockwise. I'm going to go the other direction towards thriving. Now, here's the thing. There are different levels of each of these. So I have just 3 examples, but there are hundreds of different things that could bring us into the yellow zone or the green zone or to the red zone or even into trauma, which we're going to talk a little bit more about in a minute. All right. So, the area that we're really going to concentrate on is that trauma in the red zone, because when we're feeling overwhelmed, here's the thing, when we are feeling overwhelmed, our body has turned on the sirens, right? The alarm is on and it is going danger, danger. Yet we often kind of ignore it, right? Unless we have something happen like a heart attack or a stroke, then we're like listening. We're like, oh my gosh, I got to get into the hospital, call the ambulance, 911, all those things. But here's the wonderful thing about our bodies. Okay. Not to say that overwhelm is not going to take you at some point. You stay there too long, you will find yourself. Okay. The number one cause of death for women is heart disease, not breast cancer. All right. Heart disease. If we stay there too long, we are going to damage our heart and we may find ourselves having a heart attack. All right. Or a stroke. But again, here's the amazing thing about our body. Okay. It wants to do everything it can to keep you alive. And here's the thing, it's doing a really good job because right now there are 15 counting me on here right now. Okay. that are alive. All right. So it's doing a pretty good job, at least for us. Okay. But there's going to be a time that it's not going to have the capacity or the capability. And we are humans. Okay. And we can't live in a chronic stress state without it affecting our health. Okay. So if we spend too much time in that red zone overwhelm, it causes trauma. Our body goes into that freeze state. It's going to say the siren is going to have to be turned off at some point, and it's going to take you to that trauma freeze state. Now, I know we often think of trauma as this awful event that has occurred, and trauma can be related to an awful event. All right. Just using the current situation in Florida, the hurricane, right? However, it's not the event that causes the trauma. It's how the body, each person is different, how each person's body handles the experience as the body is going through the event. Okay, so we're going to divide people up in Florida. We're just going to use Florida as an example because it's so fresh right now and what's going on. And we're going to divide Florida up into different teams. We're going to have the blue zone thriving team. We're going to have the yellow zone surviving team. We're going to have the green zone struggling team and the red zone overwhelmed team. And if you know what team you're on, go ahead and put that in the chat, right? Y'all, this is something I want you to get used to. I want you to get used to knowing, where am I at? Okay. Now you can use your default where you tend to be, or you can put right now I'm in the whatever zone it is. Okay. So my default zone tends to be the green zone. All right. And I would say right now, because of the things I did before I got here, oils was one of them. I would say I'm definitely at least in the yellow zone right now. Okay. So you can put whatever. Sue just put her default as green. Lisa's probably trauma. Okay. So just share, let us know where you're at, because this is important. All right. So those thriving, just to let you know, going through a hurricane, those thriving will experience stress from the event, but they may move into the acute fight and or flight response, the yellow or green. They're going to have energy though. Okay. And they're going to get things done. This is natural. This is why we have the stress response in the first place. It mobilizes us to move. Okay. So this person in Florida, here comes the hurricane. They're typically in this default thriving blue zone, but hurricane comes, they are going to be stressed. That is normal. That is natural. We want that to happen. Okay. Now those on the surviving team, all right, those are the yellow zone. They're the ones you're probably going to hear yelling at everyone to do this or that. The bossy ones. Okay. They may also be the ones resisting or arguing with the authorities in regards to leaving or doing things that will help protect them. All right. Now, again, it is natural to go into a stress state when something like a hurricane comes. Okay. But it depends on where you're at, on how you're reacting and how you're going to respond. Now, those on the struggling team, like they already tend to be in the green zone. They're the ones you're going to see running around, and they may be getting a lot done. All right. But they may also be staying busy to keep themselves from feeling anxious. And if they're unable to move quickly, so this is what happens as we get older, if we tend to stay in the green zone as our default, as our movement decreases, but we're still there, we begin to feel more and more anxious. All right. And so they find themselves with anxiety. They find themselves with worry about all the what ifs, and they might have difficulty sleeping because of the racing mind. Okay. Now, those on the crisis team, this is the red zone. They were already here before the hurricane came. I'm telling you, as soon as they heard the hurricane was here, they're the ones that may end up having a heart attack, a stroke, or they may move into the freeze state and feel immobilized, unable to move into action. These are the people that you're like having to specifically tell every step of what they need to do, and you're having to lead them in that direction because they have no idea what to do. It's just too much for them to handle. So they're shutting down. All right. So how do we know if we are in a stress state, if we're in that yellow, green, or red, or a trauma state? All right. Here's the thing, because stress is going to affect us. It's going to affect us. We're going to have stressors in our life. Today, there is no way for me to get away from the stressors in my life. So I was going into a stressed state. That is natural. All right. But here's the thing, trauma actually changes our biology. right? It flips epigenetic switches on, it causes cancer, and so much more. So I want you to understand, all right, if you are in a trauma state or if you're in a thriving state. And again, trauma does not mean that there's one specific event that happened, okay? So my question for you for this webinar specifically, do you have stress or do you have trauma? And if you're curious, if you can have both, again, I said the answer is yes. So if we can take action, here's how we know. If we can take action, we are in the stress response. We are in what's called the sympathetic nervous system. All right. The sympathetic state is moving us. We have the energy to take action. If we can't take action, we have moved to freeze trauma. All right. Now, what I want you to understand is we can be moving through these all day long. So maybe you are in a stressed state when it comes to work. All right. But maybe because of some type of trauma, you come home and your body goes into the freeze state, the trauma state, or we could flip that. All right. It could be either way. So I want you to understand there are different triggers that can trigger us in those different states. Now, if we are in something like chronic depression, we are stuck in that freeze trauma state and we are not moving. We are immobilized and we are not moving through the different stress states like we would be if we were in thriving to the stress states. All right. So let's look at this a little closer. Let's say that you have a goal. You have a goal. You plan on walking for the day 30 minutes. Okay. Because you heard Shauna tell you that that's a good thing to do. And though you know in your mind that it's good for you, you find yourself not doing it. All right. This would be a sign that you are not taking action in regards to this goal. You have moved to freeze. Okay. Why? It could be that you spend a lot of time in the red zone and you do not have the capacity to add one more thing to your plate, or it becomes too much and your body goes, I'm going to shut down. Okay. So Lisa asked, do you feel this can be more biological versus environmental issues as well? Hope that makes sense. Lisa, that makes complete sense. And that is diving deeper than we're going to go tonight, because that's diving into all the different stressors that are out there. And some stressors are biological, some are environmental. All right. Plus there's some other categories too. We're not going to get into that, but I want you to know that you have multiple stressors that can affect you and stress you out. So you could be in the red zone physically because of the biology going on in your body, being overwhelmed. Okay. I'm just going to throw something out like Lyme's disease. Okay. Your body is overwhelmed, but emotionally you're like, I don't really have a lot of stressors in my life, but your body is still overwhelmed. Okay. It could take a virus like COVID and it could put you in the trauma-free state. So I hope that helps you kind of understand it from a less emotional stressor perspective. Okay. So, again, if you are not taking action, all right, towards something like a goal, I'm just using a goal as an example, it could mean that you're spending a lot of time in that red zone. And again, that you don't have the capacity, right, to do one more thing without your body shutting down. Now, if you were in the green zone and I was asking you to go for a walk, guess what? Like your body would be going, yes, please, unless you're in that trauma state. And if you're in that trauma state, okay, body's going to go, nope, can't do it. All right. So Stacy's asking, can I be in more than one zone at the same time? I have symptoms from different zones, so I don't know where I am. So Stacy, yes and no. Yes, you're going to look at if you have, let's say, things that are in the yellow and the green zone, that's yellow is closer to the thriving. So to get to the green zone, you're going to have already gone through the yellow zone. So yes, you're going to have more symptoms. The red zone actually is just too much of the yellow and green zone. Okay. So first we typically move into resistance and then we're going to fight. And if our body finds that fighting isn't going to be enough, and we might even yell and try and move things with our mouth, okay, then our body starts going into the green zone. All right. So if in the past you've experienced overwhelm, that red zone, along with, let's say, exercise performance, and your body remembers, it can also put you into that trauma-free state by shutting you down, because it's like, I remember your body, and I'm pointing to my mind, but I'm really meaning your body is like, I remember when, all right, I was too tired and you took me for a 30-minute walk and I was down for 2 days. I'm not going to let that happen to you again. So I'm going to shut down. All right. Now, again, if you're not exercising because of trauma, no matter how much willpower you use, your body, because it loves you so much, is going to continue to do all it can to protect you. Your body, your nervous system is amazing. It really is amazing. However, for our minds, it often feels like self-sabotage. And the mind is even going to tell you that you're failing or that any other limiting belief that may be inside of you, right? It might be saying, what are other people going to think? Why can't you do this? Why aren't you good enough? All the things, okay? And what this does is this causes an incoherence between our mind and our body. It causes chaos between us spiritually, emotionally, and physically, because what we might want to do, we feel like we can't do, is even though we're trying as hard as we can, okay? So if you've ever felt that way, all right, like I really, really want to do this, I just can't. No matter how hard I try, I just can't. I want you to put trauma inside of the chat, because that is what it is. Your body got too overwhelmed and it moved into the trauma state. Now, again, trauma can be this big event, but it can also be just too much stress for too long or too much stress at one time. All right. Okay. So here's the thing. There are a lot of techniques out there, and we can spend time trying to figure out the trauma and go from there. And that in some ways can work, but here's the thing. If trauma is an overwhelm of stress, it could have been 10 different things inside of there that brought you to that trauma. And you may not ever find all 10 things. So what can we do? Okay. What if we started giving our body what it needs to heal, no matter the trauma? All right. Because here's the thing. It's not about, again, the traumatic event, if there was even an event. Okay. It's an experience that was too much, too often, or too much, too quick, that your body couldn't handle the stress and moved into the parasympathetic trauma response to protect you. Your body was doing exactly what it was created to do. Okay. So today I want you to know that if there are areas in your life that you feel stuck, like no matter what you do, nothing changes, you are okay. You are not broken. Okay. Your nervous system, though, is in a pattern that was created at a time to save your life. And the question we have to ask ourselves now is, that pattern serving us? All right. And what we can do is we can start giving our bodies new experiences to feel safe, to feel supported, and to move through the stress continuum back to that blue zone thriving. All right. So if we're in that trauma state, unfortunately, we can't just jump over to thriving. Wish we could, but everybody I've learned from, and I keep looking for more, okay, say we have to go back. We have to swing that pendulum back the other direction. So we have to move to the red zone, green zone, and yellow zone. But here's the thing. We want to do it gently. Okay. And so how can we do this? Well, there's lots of different things, like I said, that we could do. But what we don't want to do is cause more trauma. All right. So here's the thing. Often if we're in that blue zone freeze and we do something like set the goal to walk and we force ourselves to do the action. Has anybody ever done that? I'm going to do it no matter what. I'm going to do it even if it kills me. Anybody ever said that before? Even though our body is screaming, and it might even be screaming physically, okay, but it's screaming danger, danger. All right. We have to do this gently so that we don't continue to make more trauma for our body. Okay. And we can do that. I'm just letting you know we can do that. So in the past 3 years, I've actually been following several trauma experts. I don't know if you've ever heard of any of these, but if you have, you can type it in there. But I have been following Alex Howard, Peter Levine, Irene Lyons, Sarah Bassard, and Dr. Amy Apigan. Now, I want to tell you, I've learned a lot from each of them, and I took the information that I've learned, all right, and I created the stress continuum that you see right here. And it has helped me to better understand where I am and how to move towards healing, because I'm a visual person. I needed to visually see it, all right? What I've seen over and over in both myself and the women that I've worked with is everyone has a limit. Okay. They may work towards a goal for 2 weeks. They may work towards a goal for 4 weeks. They may work towards a goal for 6 weeks, maybe even 10 weeks, and they might make wonderful progress. But unless they actually change their nervous system, they're going to find themselves back to where they were, and sometimes even having more issues, trauma, than they had before because they couldn't handle the extra stress. Even if the stress was eustress, eustress is eustress, exercise is eustress, walking is eustress. Sometimes if we are in that burnt out red zone, we can't even take stress that is good for us. So this is when I decided that lowering stress was great if that was the only issue. But most women have trauma, okay? Experiences that must be healed to increase their capacity for change, to allow their body to feel safe. And when our body feels safe and when it feels supported, okay, our capacity increases. And these new experiences make new patterns that allow change to occur without added stress or trauma. All right. And that's what we want to do. We want to move into the healing state. So Stacy says, are these PowerPoint pictures in your book, or is there a way I can print them out? So Stacy, this picture right here, the stress continuum, if you haven't received an email where you could print it off, just send me a message and I will send you it for that. So this is not in my book because this has been something I've been working on. The very middle part is inside the book. We're not talking about that tonight, but that part is. We're just talking more about this outer part. We're not even getting into necessarily the healing stages that are inside denial, anger, bargain, depression, and acceptance, but we are, but I do talk about the healing state. All right. So here's the thing. If you feel stuck in an area in your life, and we're going to use, for example, weight loss, okay, because there's a lot of us that have been there, that is a sign that trauma, the free state, is affecting your ability to reach your goal, okay? And I want to let you know that you can do every diet, every exercise program, take every supplement, but if your body does not feel safe and supported, it's going to return to what it knows best to protect you, and it will help you unfortunately gain back the weight because that's where it feels safest, and sometimes even more. All right. And sometimes you even have more issues than you had before, and we don't want that. So how do I know this? This is not just for me, y'all. I want to let you know that Dr. Folletti, who worked with hundreds, thousands of women, okay, worked with men too, but specifically women, to lose weight with a very successful program, okay, found that 90% or more of his patients would lose weight while in the program, and then within a year would gain it all back, and often more. And this is also what they saw on The Biggest Loser. Okay. Now, Dr. Folletti didn't understand why until him and his team began using questionnaires to better understand their patients before and after the program. And what came from that research was greater than Dr. Folletti had ever expected. And it is now known as the ACEs score, Adverse Childhood Experiences. Okay. What they found was the higher an ACEs score, which is trauma in childhood, the greater the risk the people were for chronic diseases, including obesity. When Dr. Folletti and his team began to use this information to help their patients, all right, they were being able to see progress occur, and patients were able to lose the weight and keep it off. All right. And what they did to help their patients heal the traumas they had experienced is they gave them new experiences for their nervous system, okay, using somatic exercises. Somatic means body. And the patient's outcomes improved without returning to previous health levels, which was pretty amazing. And this research continues today in all areas of chronic disease, not just obesity. But how it got started was they were trying to figure out, why do these people continue to go back to where they were when they used a program that was working? All right. And it was all because of trauma. Now, again, they were specifically looking at childhood trauma. Since then, Dr. Amy Appigan, who I've taken 2 trauma courses with since July, she looks at trauma as not just childhood. So we have that, but we also have anything from the womb, okay, to currently right now. If you were overwhelmed this morning and in the red zone and something happened that took you over the edge, you could have had a trauma response today and not have been anything that you could write down in a journal and say this specific event occurred. Okay. It was just too much stress to the point that your body said shutting down. Okay. So here's the thing. If you have a health goal that has felt impossible, a life goal that has never happened, trauma plays a part in your ability to reach those goals, even if you don't know what caused the trauma. Okay. I want you to know that your body experienced it. It just experienced something more than it could handle, and it affected your nervous system. Okay. It affected your body's ability to not only handle stress, but a lot of other things too. Okay. Now, again, this could have happened anytime between the moment you were created in the womb to the moment that you are sitting here right now. Okay. Now, here's the thing that they have found. Most chronic diseases are found 20 to 30 years after the traumatic event to the nervous system. All right. So what they're finding is if you have someone in their early 20s that are starting to show chronic disease, it was probably something in birth to the first couple of years. All right. If it's happening in the later 20s, okay, chances are it happened in those first 10 years. If it's happening in, I hope that makes sense. They're looking at it as most chronic diseases are occurring 20 to 30 years. That's how long the biology in the body has changed to create this disease. All right. So before you embark in another diet, another exercise program, or think maybe I need to change my career, I'm going to highly recommend something that we're going to talk about in just a moment, and that is the 21-day journey, trauma to safety. And here's why. There is a line between the blue and the red, okay? And we want to move from trauma to that red zone safely, all right? So this is called the essential steps through your nervous system to address stored trauma in your body. Okay. And as I went through my own 21-day journey in Dr. Amy Appigan's program in July, I have begun to implement the essential sequence she recommends from her years of research, along with the research of the other trauma experts that I was talking about earlier, to put together my own 21-day program that will become a foundational course before the Exceptional Health Masterclass. So some of y'all know what the Exceptional Health Masterclass is. For those of you that do, this is going to be a foundational start before I have people move into that. If you don't know what it is, it's okay. You don't have to worry about that right now. You can learn about the 21-day journey, and then you can decide about that later. Okay. So what I'd like to do is go ahead. Now I have this page. You can go to shawnakale.com, 21-day journey. Right. So let me tell you a little bit about it. I have these little steps on here because each day is a step. I could have called this step 1 through 21. I could have called this 21 exercises. We're saying 21 days because here's the thing. If we don't have something to kind of put us a limit, then we tend to kind of get stuck more easily. So I want you to understand it is 21 days that we are going to go through this, but I'll tell you more in a minute. I am going to guide you through this process, one video at a time. Okay, so there'll be a day 1 video, 10 minutes or less, giving you some instructions on a somatic exercise. Now, this is not going for a run. This isn't going for a 30-minute walk. The first 7 days is about safety. Okay, the second set is about support, and the third is about capacity. We're going to talk a little bit more about that in just a second. Okay. Again, this is a foundational course. What I want you to understand is that trauma work doesn't have to be scary, and it doesn't have to be confusing. Okay. This is not going to be a 21-day journey where you're trying to figure out your trauma or you're going to be reliving your past. All right. That is not what these 21 days are about. This journey is about giving, okay, your body, your nervous system, what it needs right now in the present moment to heal. All right. So the key to addressing stored trauma in your body is in the biology itself. all trauma becomes stored in the body on a cellular level. So as soon as you hit that freeze state, that trauma state, so we're going to use an example of something really short, okay, really short. You drop a glass and you freeze, okay? Right when that happens, that makes a change, okay, shock, in our cells of our body. Now, typically with something like that, if you haven't been in the trauma state a lot, all right, you're going to wake up, okay, unfreeze, thaw out pretty quickly, and you either might feel a little overwhelmed. Oh my gosh, there's this glass, I don't know what to do. Or you might move right into that green zone of, oh, I got to hurry up and clean this up, okay? Or you might start yelling at whoever was close by that you're going to blame, because we're in a stress state, and that's when we blame for making you drop the glass in the first place. All right. So that's how we can quickly go into a freeze state and out. But what I want you to understand, as soon as you move into that parasympathetic, this is the dorsal side of that parasympathetic, it makes change at the cellular level. All right. What we want to do is we want to start making change at the cellular level for healing. All right. And there is a step-by-step process for us to do that. All right. There's a sequence that we're going to do one step at a time that is very gentle. All right, to help prevent us from moving back into trauma. So the value of this journey, okay, we have to make a choice if we're going to invest in our journeys. All right, are we going to stay right here where we are, or are we going to invest? So I want to let you know that this course is directly tied to what you put into it. It's 21 days long. If you do 3 days, you're going to get like what? That's 1/7 of the progress that you could create if you did all 21 days. All right. Now, here's the thing, y'all. I'm going to tell you, this is a really, really good deal. I want you to know this is a really, really good deal. All right. It's a one-time payment of $50, and it's going to give you access to this 21-day course. And it's going to be 21 different guided exercises. And it's going to all be daily pre-recorded. All right. With a somatic or a neuroaffective touch exercise. And it's in a specific order. So here's the thing. You have to do day 1 before I'm going to let you open up day 2. Okay. So you're not going to get to go in and pick and choose which exercises you want to do. You're going to start with day 1. All right. And here's the thing. All you have to do is watch the video. Now, are you going to get more out of it if you actually perform the exercise? And I don't think that you're not going, but there may be some exercises that you're like, this one's not for me. And that's okay. Watch the video and then make that choice and that decision. Okay. So the value of these 21 different somatic exercises, $825. All right. You're paying $50. All right. Experiential and intellectual journey. This course is experiential in that I'm going to give you an exercise to do. And for you to create change, a new experience in your body, you are going to need to perform that exercise. But it's also an intellectual journey into your nervous system. So you're going to get to understand why those exercises are important, okay? And then you're going to take 21 days to create and build a routine to support you through your healing journey. So even though these 21 days, you're going to be learning these exercises, your journey is not going to be over in 21 days. So I want you to all to understand that I am not expecting that your journey is over in 21 days. I say that my journey's over when I'm about 100. All right. And it's time for me to go to heaven, right? Between now and then, I'm not looking for a destination. I'm looking for consistent healing to my past traumas and to not create more traumas on my journey. All right. Now, there's also going to be group one-on-one coaching. So you're going to receive 6 group coaching calls where we're going to practice the exercises, and we're going to learn how to move through safety, support, and capacity. And when you complete all 21 days, you're going to receive, this is your reward, a one-on-one coaching call with me. That's a value of $700. So we're looking at $1,825, all of those things put together, all right, for $50. Now, here's the thing. There's 6 group coaching calls, and they all are going to happen in October, all right? So even if you're only on day 3 and it's week 3 and you're like, can I come to this group coaching call? Yes. Okay. You can practice these with us, even if you haven't gone through the 21 days. But here's the thing. You get the one-on-one coaching call with me after you have watched the 21 days worth of videos. All right. All right. So here we are. We don't always have the capacity to complete a course in 21 days. And again, that's okay, because you're going to have until the end of the year to complete the 21 days. All right. When we have trauma stored, we often feel stuck in different areas of our lives. And when we become aware of the areas we're stuck in today, we can begin to take the steps to heal our trauma with new experiences, safety, and support for our nervous system. So my question for you is, what if your life could be different? What if it could be different? Okay, if you were actually fully present rather than just reacting. So here's some questions. Are you here physically, but not emotionally? Okay. Do you struggle to have energy to be present? Do you find yourself always roaming another direction? Okay, and that could be physically or mentally. All right. You lose hours staring at a screen. What time is it? Oh my goodness, it is. And you look at the clock and you're like, where has the time gone? All right. Your mind wanders off in a meeting or a conversation. You're having a conversation with someone and you cannot hold it. You cannot hold it there. You're not able to stay in the present moment. If you suffer from physical symptoms such as headaches, nausea, joint pain, or stomach aches, those are all signs that we are in the trauma-free state. All of those are, okay? And here's the thing. Amy, Dr. Amy that I follow, she believes that 70% of people spend 70% of their time in this trauma state. And that's why we have the chronic disease that we see today. All right. Now, maybe you're saying, I've tried before. You've tried your best to change the pattern. You've tried to strengthen your willpower. Your body will sabotage you by shutting down or overreacting when you don't want it to because of stored trauma. We have to take care of this trauma part. Okay. Again, we don't have to go back to the trauma. We don't have to find where that trauma is. Okay. It may come up, not going to say that it won't. I found an experience in July doing one of these exercises, and it wasn't until our 20th day of our 21-day breathe reset, laying right here on the table behind me, and a trauma from my 13th year, I'm guessing I was around 13, came up. I had no idea some of the things that I have been stuck in and some of the reactions I have was in regards to this trauma until it came up during a breathing session. And that was almost 3 months after I walked through a thing. It's how long it took before it came up. All right. And that's okay. Sometimes it takes time for things to come up. It was not hard for me to go through it. It was like mind blowing. It was like, oh my goodness, now I know, right, why I've been acting this way for so many years. And I'll probably be sharing more about that as we go. All right. So how do I know if this course is for me? Well, here's the first thing. I want you to know that if you are ready to understand your basic survival system, your nervous system, and how it impacts your life, this is for you. Okay. If you're ready to shift your emotional state and address stored trauma, again, this doesn't mean finding the traumas, but actually saying, hey, I'm ready to take the steps. That means I'm going to do the exercises. This is for you. All right. If you're ready to start living on your own terms, you're tired of your body taking over and shutting down when you have something that you really want to do and you feel like you don't have the energy to do it, this is for you. Okay. I want to go over really quickly these 21 days, what you're going to be receiving. Okay. I'm not going to say all of them, but I want you to be able to see every day we're going to be having a little talk. I'm going to go over on day 1, your journey, tracking your nervous system. Okay. And then you're going to have an exercise to do with that. All right. On day 2, where am I? Am I safe? Okay. Little 5-minute topic. And then I'm going to explain the exercise for you in that video. All right. So you're going to have 21 days worth of videos. It's going to be inside my Experienceify learning program. After you watch the video, you're going to be able to click complete. Little bells and whistles will go off, allowing you to know that you completed it, and you're going to get 1 XP point. Okay. When you have 21 points, you'll receive an email from me saying, hey, it's time for us to have a one-on-one coaching call. So real quickly, I want to share who this course is not for, and then I'm going to start answering some questions. Okay. If you're not currently able to function independently, physically, mentally, or emotionally, meaning you need someone to tell you nonstop what you need to do, this is not for you. All right. And if this course is not for those who could not or would not be able to do their own work, but rely on others to fix them. I am not here to fix you. Now, I want to be honest, for years and years, I thought my job was to fix people. And then I realized that is not my job. I am here to create programs and to share this information to help you on your journey. But I cannot fix you, but you can put these things into effect and amazing transformation will occur. All right. Number 3, this course is not for those looking for a doctor. I am not going to be your doctor. I am not a doctor. I am a physical therapist, but I am not going to be your physical therapist during these 21 days, nor am I going to give you a diagnosis. All right. This course does not provide individualized medical or psychological care, such as a diagnosis, therapy, or treatment. This is a sequence of somatic exercises that I'm going to take you through to help your body move from trauma to healing in a safe and gentle way. All right. So how much time do you need to complete this program? You're going to need to invest at least 15 minutes a day to track, to watch the video, and to perform the exercise. All right. Optional, you'll have access to 2 group coaching calls each week, 1 to 1.5 hours. Okay. What do I need to do this 21-day? Well, you're definitely going to need to have internet access and a phone or a computer. You can do it from either, but you need to be able to check an email, and you need to be able to go into the learning platform to watch the exercise. Okay. You are going to need to print off the daily tracker. All right. And I highly recommend having a journal to write in the 21 days. This is going to help you document how you're feeling and to watch your growth, but you don't have to. I love having a journal to write in because it allows me to go back and go, oh my goodness, this is where I was at here, and this is where I'm at now. All right. So what do I need to do? Oh, this should have said, sorry, y'all. This should have said journey, 21-day journey, instead of reset. But how is this different from the 21-day reset? Some of y'all just got done doing the 21-day reset with me. I want to let you know that the 21-day reset is a program using breath work for all 21 days. This 21-day journey is using a different exercise every day. Now, I think it was day 15 that we are going to talk about the breath. Yep. So day 15 is about the breath, but every other day is not necessarily about the breath. All right. So I want you to understand that the 21-day reset was using one type of somatic exercise, breath work, for all 21 days. This is a new tool, a new exercise, sequentially helping you move step by step by step from trauma to safety. All right. And again, this is looking at the nervous system and helping you move out of the blue zone trauma and slowly thaw and move towards the red zone, green zone, yellow zone gently. All right. How is this different than the Exceptional Health Masterclass? Well, the Masterclass is a 10-week coaching program set up for you to reach a health goal. And once you pay the total price of the Exceptional Health Masterclass, you have all the trainings for the lifetime of the program. So everything that I teach, including this 21-day journey, is inside of my Exceptional Health Masterclass. So those people that are here, like I saw Leslie here, she is part of my Exceptional Health Masterclass for life. She already gets this 21-day journey. It's part of her masterclass program. All right. What type of exercises will I be teaching, and what if I cannot do them? Well, these are somatic exercises. They're not going to involve any type of strenuous exercise. Most of them are going to be sitting in a chair. Others may have you moving throughout your home. And here's the thing, if you don't feel comfortable doing one of the exercises, we're going to talk about that on day 1. Okay. It's okay. There's plenty. That's why there's 21 different exercises. Okay. You're going to have plenty of choices. Again, how long do you have access till the end of the year? All right. What is the refund policy? There is none, y'all. This is $50. And I'm telling you, I paid a whole lot more than that. All right. How long have I been doing trauma work? So here's where I wanted to get. As a physical therapist, y'all, I was not educated in trauma work. On my own health journey in 2010, I was led down a road that helped me realize that childhood trauma, because of that ACEs score, had caught up with me. And I was now also dealing with adult trauma from too much stress. All right. As much as the trauma aspect, okay, interested me for my own healing, I was not interested in teaching or becoming a trauma practitioner until, okay. In 2020, I attended my first online trauma summit, and I've been learning again from Dr. Amy Appigan, Irene Lyons, Peter Levine, all of those. I'm just going to let you know, I was still resistant. I was in that yellow zone to dive any deeper into trauma training until this year, 2022. I did my first 21-day reset program with the Reconnect in Australia in January of 2022. This is where I've learned specific breathing techniques to reset the nervous system, specifically the autonomic nervous system. This is where our stress response and cell danger response is, that is triggered based on past experiences, trauma, daily stressors, and habits. And here's the thing, after I saw how much breath work can make a change to the nervous system, I had to learn more about the other somatic exercises. Remember, I said the breath is like number 15 on the sequential order that we're going to go through. And that is when in July, I decided to take my first course through Dr. Amy Appigan, learning the essential sequence to healing trauma. Okay. Now, using somatic exercises, I have seen a change in my own nervous system. And though I have not decided yet, y'all can pray for me, if I'm going to become a certified trauma provider, because there's like 8 different modules. I've done 2. I'm not doing one the rest of the year for sure. But I am praying on if I am going to continue that direction. But what I do know is that I have decided, because of the work that I have seen, not only in myself, but the work that she has done, the 21-day journey is a necessary foundation, and it's going to help equip women that I work with, those that are stressed out, overwhelmed, and worn out, all right, to better understand their nervous systems and why they do the things they do and why they don't do the things they want to do. And it's all related to our nervous system and stored trauma. Okay. So my mission hasn't changed. My mission is still helping women live a life of less stress and more energy. And this course is going to help women better enter something like the Exceptional Health Masterclass and reach their health goal in 10 weeks using the exceptional formula, because they are not going to be as stressed. All right. So again, this page is open. If you're not part of my Exceptional Health Masterclass, this is where you will go to get started with that 21-day journey.